Hello, and thank you for joining me. I'm John Romary. I have a guest, Diane Romary, here with me tonight. And I noticed there's a growing problem of school-age children who have mouth abnormalities that go untreated, and that has negative consequences that go for the rest of their lives. I'd like to discuss that with you if you would like.
Oh, I'd be happy to.
And can you tell me about what you do for a living?
Well, I'm a nursing assistant with the Madison Metropolitan School District, and I work at Van Huysen Hamilton, which is an elementary school and a middle school. And I have also been a dental hygienist for a few decades. And currently, I am also an orofacial myofunctional therapist. So I tend to focus and, and able to pick up some abnormalities that maybe not all people do.
What types of abnormalities?
Well, there, one that I notice is tongue tie. And to explain a little bit about tongue tie, when you lift your tongue up, there's a piece of tissue that connects the tongue to the floor of the mouth. And that should have disappeared by the time of birth, but quite often it stays, which makes the tongue a little short.
Don't doctors detect that when children are born, or do they?
Well, now more and more physicians are catching that in the delivery rooms of the hospitals or home births, but there still are many students that I see in the younger grades and middle school who still have tongue ties. So apparently some are being missed, or it's just being called more attention to. Or it may not be of a big concern if babies and children are able to eat and speak okay, so it may not be of a big concern.
And what would you like to see happen with that?
Well, I would like for school nurses and nursing assistants to be able to spot a few of these abnormalities and notify the parents that this is a possibility, and it would be a good idea if they checked with their physician, their family dentist, to see what their opinions are. I know in the school nurse setting, we call and notify parents if we see other abnormalities, such as a bad sore throat. You may want to take your child in for a throat culture, various skin infections. I mean, whatever we see that we think the parents need to know about. So I don't feel that this particular area of the mouth should be excluded. I feel this should be brought to the parents' attention also.
And have you brought this up to anybody before? Like your school nurse that you work with?
Well, I have mentioned it to her, and I have mentioned it to the health service coordinator for the Madison School District. And they have, they're open to the idea, but there are various factors that could prohibit this. One would be time and priorities for overall health, although I feel this is quite a priority, and how nurses and nursing assistants would be trained to spot these abnormalities, and so it wouldn't be like overlooked, or not overlooked, but over. And we don't really diagnose, but so that it wouldn't be called attention to too often.
But if you're not diagnosing, what would you be doing? Like, how would that
We would
be
be
different?
assessing and saying there's a probability that your child may have a restricted tongue that should be further evaluated by a physician or your dentist. So I'm hoping this will that it won't just stop here, that the health service coordinators downtown at the administration will take this, seriously and look into it.
And I had a chance to talk with the nursing coordinator at the Madison School District.
Oh,
and you
and
talked with her too.
I talked to her briefly, and that what did she say when you brought that up to her?
Well, she said she would like to see it, but she needed more information about it.
Like on the research end,
Yeah, and
of
what
it?
all that would involve.
What the training would involve?
Yeah.
And who would do the training? And I know there are 1 or 2, 3 in-services throughout the school year where various topics are brought to attention. So that would be something to consider for a future conversation to have, and have a presentation done by a professional to create awareness and some expertise on how to spot it. And I know when I find I notice tongue ties is when I ask students to lift their tongue so I can insert the thermometer under their tongue. And then I can notice, like, oh my goodness, they're having difficulty even lifting their tongue, so I can place the thermometer. And that's not even doing a special screening. It would just be spotting things when it comes across. And also, if I am looking at a sore throat, I will use a flashlight and say, open as wide as you can, stick your tongue out, and let's see what I can see. Well, in some cases, I can see the tonsils, the soft palate, I can, just see everything beautifully. And then in others, when I do that, all I see is the back of their tongue blocking everything. There's no way that I can
And
see
do you
anything.
say anything, or do you keep it to yourself?
Well, I've been keeping it to myself because just feeling a little uncomfortable, but really,
Like it's not your place to say anything?
Like then they would say, well, where do I go? What do I do? But within the last 2 weeks, I have spoken with 2 parents that I saw a lot of issues and brought it to their attention, just as a piece of information that they want to observe in their own children. And when I'm speaking with children, I may notice that they're continually mouth breathing, kind of hanging their lower lip down, and they could have a stuffy nose for various reasons, having a cold, having allergies, something that could be treated also. And let's see, what else do I notice? Sometimes I'll notice students maybe speaking with a little lisp, or when they're talking and speaking, I may notice that they're thrusting their tongue, and that they may have an open bite where they're biting on their back teeth, but I see the front teeth are not coming together.
Oh, so you do notice a lot, and that's very interesting, and I hope we can find a solution to the problem. And
well, I do too, and I
keep
appreciate
bringing it
you
up.
giving me the opportunity to just bring this to light and plant some seeds of curiosity. And
yeah, thank you for taking the time with me.
well, you're very welcome. Thanks. Bye.
Bye.